I feel like we have a great specialty here at Living Well, which is the treatment of concussion injuries and post-concussive syndrome. I'm wondering from your point of view as a physical therapist, how is your treatment based?
Yeah, so usually, and it can be right away after someone's sustained a concussion, or it can be, time frame after. It's never too late to get treatment, but it is usually better to get it as soon as possible.
As soon as possible,
yeah,
really?
yeah.
Even if somebody comes in and they're like, oh, I can't even open my eyes kind of thing.
Absolutely, because that's when they usually need it the most.
Yeah.
And it could consist of just some gentle, really kind of manual massage work, and kind of progressing from there. And so for that, because everyone gets concussions differently and everyone reacts differently, their rehab is going to be very individualized in that sense. We're going to start off slow and just setting goals from there, and consisting of a lot of just manual work to help relax the muscles around the neck and shoulders, as well as doing some vestibular, which is kind of connecting the brain balance and with your vision to kind of help them recover in that sense as well. So that would consist of doing a lot of like balance work and visual work, and just being able to kind of connect your brain to your environment in that sense as well. Also with return to sport, so that would be kind of further down the line, but getting them to be able to return not only to sport but to school as well,
Right.
and helping them progress from their ability to focus and concentrate, as well as kind of getting their heart rate up with more intense sport as well.
Yeah. So what I find, when I have a patient come in, and the way that I treat concussions is I do a lot of, again, muscle work like you do. Oftentimes people will have their concussion is whiplash related as well.
Right.
So people can come in and have symptoms that really they're overlapping whiplash, concussion syndrome. Because if your head snaps back and you hit your head, your brain also moves within your skull, and we know that creates small little tears in the axons in your brain. So, but the other thing that happens is I find that people get tears in the muscles in their neck.
Yeah.
So those will also create lingering headaches. So, and then the spine will be out of alignment as well. And the very top vertebra in the cervical spine, and I know you know all this stuff, but so what I focus a lot on adjusting that area, because that's that vestibular feedback, meaning the balance, it's proprioception, meaning how you walk in the world, how you sense your environment. So I know that adjusting the occiput and like C1 and C2, which are the first vertebra in there, that really helps people progress faster too, and helps them with headaches and also even visual changes.
And I know that's a big concern for patients when they come in, is when I say I do think chiropractic adjustment would be beneficial. I think their concern is, I have a neck injury, right? I have a head injury. I don't want anyone adjusting my neck, and they're really nervous about that. And I do try and explain to them that no, it isn't this big crack adjustment. What do you tell people?
Yeah, exactly that.
Yeah.
It's very gentle adjusting, and I'm not going to do anything that's going to make it worse. And I have treated so many patients over the years who, they will come in with a headache that they've had that they think is coming from a concussion. And it just won't clear. And adjust them once, and they walk out, and they're like, oh my gosh, my headache is gone. I'll say, well, you see, your headache wasn't because of your concussion. Your headache was because of the muscles and because of the vertebra giving this pain feedback. It's not your brain that hurts generally, it's your muscles that hurt. So that's how I treat people.